Welcome to our session on Marketplace Coverage and the Affordable Care Act. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. The name Asclepius is a bit of a tongue twister, but there were already so many wonderful organizations with the words Kentucky and health in their names. You may not be able to spell, pronounce, or remember it, but at least you'll recognize it if you see it again. Asclepius represents medicine and healing in Greek mythology. The mission at the Asclepius Initiative, or TAI for short, is to provide education and build support for the idea that everyone in the U.S. simply has continuous healthcare coverage from birth until death, so that you don't lose your insurance if you leave your job, get divorced from the policyholder, or move across state lines, events that can happen to any of us at one time or another. We cannot begin a discussion on the marketplace without mentioning the Affordable Care Act, more commonly known as the ACA. Passed in 2009 and signed into law in 2010, the goal of the ACA was to make healthcare coverage more accessible and affordable to people living in the United States. The ACA contains a number of important rules and regulations that help drive the number of working age uninsured down to just under 10% in 2024. One of the main ways in which it has expanded healthcare coverage was by creating marketplaces where people who do not have coverage through government programs such as Medicare or Medicaid, or who do not have affordable job-based coverage, can buy individual and family health insurance. Prior to the enactment of the ACA, about 18 to 19% of non-elderly Americans were uninsured. In part, this was due to the fact that about 20% of those who applied for coverage on the individual market were denied coverage outright, largely due to their health history, otherwise known as pre-existing conditions. In addition to establishing the marketplace, the ACA allows states to increase the number of people who qualify for Medicaid. ACA removes the ability of insurance companies to discriminate against people on the basis of their health. ACA-compliant plans cannot deny coverage or charge more for people with underlying health problems. Another important benefit of the ACA is that most commercial plans must allow children and young adults to remain on their parents' insurance until age 26. In addition to the features I just described, a key aspect of the ACA is the requirement for mainstream commercial health plans to cover 10 essential health benefits, such as emergency services and hospitalizations. And we'll go into a little more in depth about what those 10 essential health benefits are. This helps to ensure that the plan you buy or that is provided by your employer delivers the coverage that you need. For example, prior to the ACA, many insurance plans did not provide coverage for maternity care, so people who wished to become or were pregnant had to buy special insurance riders for prenatal care and delivery. To go into a bit more detail about Medicaid expansion, the ACA allowed states to expand Medicaid eligibility to cover nearly all adults with incomes up to 138% of the federal poverty level. In order to help pay for this, the federal government gives Medicaid expansion states more money to help offset the costs of insuring more people. Of note, the number of people who are uninsured would be even lower today if all states had adopted Medicaid expansion. Another thing that could have lowered the number of people who do not have health insurance is the individual mandate. Back when the ACA was passed, there were partisan objections to the individual mandate requiring most Americans to have health insurance or pay a penalty. This was taken to court, and in 2019, the penalty for non-compliance was set to 0, effectively making the mandate meaningless. While that may sound good to some, for example, you can't make me do it, the problem is that this makes it more likely that younger, healthier people drop out of the marketplace and become uninsured. Not only does being uninsured not prevent you from getting hit by a bus, resulting in high medical costs, but having fewer young, healthy people in the insurance pool drives up the costs for everyone who remains. Speaking of increasing numbers of uninsured, policy changes affecting Medicaid in the marketplaces, which were enacted in 2025's One Big Beautiful Bill Act, also referred to as the OBBBA, are estimated to result in the loss of coverage for 16 million U.S. residents, including 200,000 to 350,000 Kentuckians. The 10 essential health benefits outlined in the ACA are outpatient care, emergency services, hospitalization, maternity and newborn care, mental health and substance use services, prescription drugs, rehab services and devices, lab services, preventive and wellness services, and pediatric services. The importance of the prohibition of pre existing condition exclusions cannot be stressed enough. Even when the ability to enroll in coverage was not denied outright, people enrolling in coverage were often subjected to exclusion of coverage for chronic or prior conditions for months or years. For example, an insurance company might agree to cover you, but would not cover care for your diabetes for 6 months. Denying care for any condition can and often does cause great harm. So the ACA makes it possible for more people, especially those who need it most, to be able to get care. Not only that, but the ACA requires that preventive services be provided at no additional cost, so no copays or deductible charges for such services as well woman exams, screening mammograms, or screening colonoscopies. For example, Lisa here doesn't have to pay out of pocket when she sees her gynecologist for her annual exam. However, if she has a problem that is addressed at the time of a well visit, such as a urinary tract infection, she may have to pay something because the valuation and management of her UTI symptoms would be considered a problem oriented service, not preventive care. The ACA also limits the amount that most people with individual or family private insurance plans will have to spend in a year for out of pocket costs. Out of pocket costs refer to money spent on copays, deductibles, and coinsurance in a given plan year. As an example, let's say the charges for Martin's knee surgery were $60,000 and the insurance allowable, the most that the provider will be paid, is $30,000. Because Martin's maximum out of pocket limit, or MOOP, is $8,000, he will not have to pay more than $8,000 for his procedure. Note that the MOOP does not include any costs Martin pays towards his premium. After Martin has spent $8,000, his insurance pays 100% of the remaining allowable costs for covered services during the plan year. Without deductible and out of pocket caps, which are set for individuals and families, Martin could have been responsible for as much as $30,000. Now let's talk more specifically about how the marketplace works. The marketplace is where U.S. citizens who aren't in jail or in prison, who live in the U.S. or are legal U.S. residents, can buy individual or family ACA compliant health insurance. Businesses can also purchase small group plans on the marketplace through a program called SHOP. For-profit insurance companies operating in a given state are able to offer plans on the state's marketplace. Some states, such as Kentucky, operate their own marketplace programs. Other states use the federal marketplace. In Kentucky, the marketplace is known as kynect. The majority of plans on the marketplace are considered qualified health plans, which means that they are ACA compliant. Plan benefits are categorized into what are called tiers, colorfully described by metal names bronze, silver, gold, and platinum. The generally understood value of the metal corresponds to the relative premium costs of the plans in that tier. So, not surprisingly, the premiums for bronze are less than silver, silver premiums are lower than gold, and so on. However, the lower the premiums are, generally the out of pocket costs, such as the deductibles, will be higher. For example, a bronze plan may have a monthly premium of $500 and a deductible of $5,000, while a silver plan premium may be $750 with a deductible of $2,500. We'll define the terminology in a few moments. I will also note that the Kentucky marketplace does not offer any platinum plans. It is also possible to purchase what are known as catastrophic health insurance plans on the marketplace. Although they must still cover the 10 essential benefits, they are designed for younger, healthier individuals. The premiums are lower, but the deductibles are higher than regular plans. In 2026, the annual deductible for a catastrophic plan is $10,600 for an individual plan and $21,200 for a family plan. Catastrophic plans are not eligible for premium subsidies or cost sharing reductions, which we will discuss in the next slide. An important feature of marketplace coverage is that a substantial number of people will qualify for income based discounts on their premiums or out of pocket expenses, such as deductibles and copays. There are two types of discounts available. A subsidy or premium tax credit is a tax credit or discount used to lower the monthly insurance payment or premium. The amount of tax credit is determined by the household's income and is only available for insurance plans purchased on the marketplace. As a rule, the lower the household income, the greater the subsidy. Subsidies do not apply to group or employer sponsored healthcare coverage. They can be used with any of the marketplace tiers, which in Kentucky means gold, silver, or bronze plans. Cost sharing reductions, or CSRs, are discounts for marketplace plans that lower the amounts for deductibles, copayments, coinsurance, and out of pocket maximums. Only plans in the silver tier are eligible for cost sharing reductions. Due to the failure of Congress to extend what were known as enhanced premium subsidies, the amount of CSR discounts and the number of people who qualify for them has decreased significantly as of January 1st, 2026. Recall that catastrophic health insurance plans are not eligible for either premium subsidies or cost sharing reductions. Another way to save money on healthcare costs is through the use of health savings accounts, which are available with some marketplace plans. They can lower healthcare costs by using untaxed money to pay for deductibles, copayments, coinsurance, medications, and other qualified healthcare expenses. HSA accounts must be set up through certain financial institutions that offer them. HSAs generally may not be used to pay premiums. However, HSA funds can be rolled over from year to year. If the HSA is set up through the employer, HSA funds remain with the employee upon termination of employment. Total annual HSA contributions must stay within an annual limit determined by the IRS, which is $4,400 for an individual or $8,750 for a family for 2026. An additional $1,000 contribution can be made for those over age 55. Previously, HSAs could only be used with what are called high deductible health plans. The IRS determines the limits for what constitutes a high deductible health plan. It is related to the deductible and out of pocket amounts associated with the plan. The lower limit of the required minimum deductible for a high deductible health plan varies from year to year. In 2026, this is $1,700 for an individual deductible and $4,300 for the family deductible. So, for example, in 2026, a plan would have to have an individual deductible of at least $1,700 to be considered a high deductible health plan. High deductible health plans also have different maximum out of pocket limits than non high deductible health plans. The most that a maximum out of pocket cost can be for a high deductible health plan in 2026 is $8,500 for an individual and $17,000 for a family. This is different than the highest allowable out of pocket maximum for non high deductible health plans. However, as a result of the OBBBA regulations as of January 2026, all bronze and catastrophic marketplace plans are HSA eligible regardless of whether or not they qualify as high deductible health plans. Qualified medical expenses are determined by the IRS and may include copays, coinsurance, deductibles, prescription medications, and vision care such as glasses and contact lenses. Many over-the-counter items are also included. Some examples of qualified medical expenses for which HSA funds can be used include doctor's office visits and lab fees, hospital services, medications, prescriptions, and over the counter, birth control, and feminine hygiene products. Another type of program that can help people save money on healthcare expenses are HRAs, or health reimbursement accounts. If an employer has less than 50 full time employees and does not offer group health insurance, they can offer a particular type of HRA program to allow their workers to use HRA funds for independently purchased health insurance premiums, such as marketplace coverage. This program is known as a Qualified Small Employer Health Reimbursement Arrangement, or QSE HRA. If the QSE HRA is set up in such a way to be HSA compatible, QSE HRA funds can be used to purchase marketplace plans that have HSA accounts attached under certain conditions. For example, a premium only QSE HRA can be coupled with a limited purpose QSE HRA. The premium only QSE HRA is exactly what it sounds like. It reimburses only premiums, but not costs categorized as qualified healthcare expenses. The limited purpose QSE HRA allows for reimbursement of dental, vision, and preventive care costs. The tax free money contributed by the employee to their HSA can then be used to pay for other qualified healthcare expenses. However, you cannot double dip and use both HRA and HSA funds to pay for the same qualified medical expense, such as a tooth cleaning or glasses. Learn more at marketplace.cms.gov. If this sounds like a lot, there are people who can help. In Kentucky, they are called connectors, and they are authorized health insurance navigators. They can help with eligibility, enrollment forms, and applying for qualified health plans on Kynect. There are two times during the year when people can enroll in marketplace healthcare coverage. Open enrollment is the annual period when individuals can get, renew, change, or cancel their healthcare coverage. Failure to sign up during this time can result in being uninsured for a full year until the next annual open enrollment period. The OBBBA has shortened the annual enrollment period by a month. Starting in 2026 for plan year 2027, Marketplace open enrollment officially ends on December 15th. However, states that run their own Marketplace programs are allowed to extend enrollment until December 31st, which Kentucky plans to do. Special enrollment period. This is a time outside of the regular enrollment period when people are able to sign up for healthcare coverage. Qualifications for a special enrollment period include certain life events, such as loss of healthcare coverage, moving outside of the prior coverage area, getting married, having a baby or adopting a child, or if your household income changes so that you become eligible or ineligible for premium subsidies or a different amount of cost sharing reductions. Learn more at marketplace.cms.gov. When Kynect sends renewal letters, they will show you the plan you're on, and if that plan has been discontinued, which is often the case, then they show you the plan that the insurer determines is most similar to what you have. This matching is based on technical data like actuarial value, not your personal needs, and it may or may not be the best option for you. For example, the new plan may have a different doctor network. The premium and or out-of-pocket costs may be significantly higher. More generous subsidies or cost-sharing reductions may be available for a different plan that the passive match ignores. A similar plan might look familiar on paper, but may fail to meet your needs or those of your family members. It is important to research your options at every open enrollment. Log in to kynect.ky.gov and use the Compare Plans tool, or find the TAI Comparing Plans tool in our educational materials to make sure that your choice for the coming year will best meet your medical and financial needs. If you fail to take action, you may be automatically enrolled in the suggested plan. Alternatively, you may lose coverage altogether. The time to act is before the open enrollment period ends. Something to be aware of when trying to research and purchase marketplace coverage is that there are companies and individuals trying to get your business by misrepresenting who they are or what they're selling. There are different ways that they can try to reel you in. With premiums going up in price, scammers are now using discounted plans as a hook. This phishing playbook uses the stress of open enrollment to capture your personal data by exploiting your fear of losing coverage. First, there is vishing or voice phishing. This is when you get a phone call and the caller ID looks official. The person on the line sounds professional, helpful, and firm. They may claim to be an agent from the health insurance marketplace and tell you that your renewal is stuck or incomplete. To secure coverage, you must provide your social security number or pay a fee over the phone. Remember that the marketplace will never call you unexpectedly to demand a payment or your social security number in order to keep your plan active. Next are deceptive websites. These may be high definition imitators of legitimate sites. They use the same colors, the same fonts, and similar logos to the legitimate sites. Make sure they have a .gov or other trusted address. You may get an email or a text that looks like an official alert telling you to verify your account. Once you click their provided link, you are on a criminal portal and every piece of information you enter is captured. Be wary of email sender addresses that are not official or if there are misspellings in emails or texts. Finally, be aware of urgency hooks, especially during the open enrollment window. Scammers may use threats of immediate coverage cancellation to bypass your logic. They'll say things like, "Your plan expires at midnight," or "This is your final notice." That manufactured panic is designed to make you act before you think. If a communication feels off, high pressure, or demands immediate payment, it is more likely to be a scam. When in doubt, hang up or close your browser and go directly to legitimate sites such as kynect.ky.gov on your own terms. To report marketplace consumer fraud, call 1 800 318 2596. Note that Medicare beneficiaries do not get coverage through the marketplace. To verify real versus fraud, remember that Marketplace will never ask for money or gift cards to enroll. A scammer may demand fees, gift cards, or crypto for payment. The Marketplace will never make unexpected requests for your social security number or other sensitive information. If someone calls asking for sensitive personal information for re-verification, hang up and call Kynect, your navigator, or the Marketplace directly. The federal and most state marketplaces have website addresses that end in .gov. However, this is not always the case. When in doubt, navigate to the marketplace site you are interested in from a trusted state government source or reach out to the healthcare.gov call center at 1 800 318 2596. Enrollment help through the marketplace, Kynect in Kentucky, is free. If you are being prompted to pay a consultation fee for enrollment help, it is likely someone is trying to take advantage of you. We've already mentioned a couple of ways that the OBBBA has and will continue to affect marketplace coverage. Approximately 47,000 Kentuckians are at risk of losing marketplace coverage. It is estimated that the average premium cost for those who purchase marketplace insurance will more than double in 2026. In addition, there is more paperwork, reduced days to sign up for coverage. Also, automatic re-enrollment will be affected by new requirements for pre-enrollment verification policies for subsidies and cost-sharing reductions. The marketplaces have been a critical solution for those who do not have other paths to coverage. Premium subsidies and cost sharing reductions have made costs more bearable for some, although plans and out of pocket costs remain quite expensive for others. On the other hand, prior to the ACA, a significant number of those who needed insurance couldn't get it at any price. We still have a ways to go to make continuous, high quality, equitable healthcare available to everyone. Thank you for coming to our session on marketplace coverage and the Affordable Care Act. Last step, please take our survey, the QR code to the left. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. The middle QR code will take you to our educational materials on the TAI website. We have a lot of amazing free resources on our website, and I encourage you to check that out. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan the QR code to the right to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.